The Marburg virus is a serious health concern. This virus, belonging to the same family as the Ebola virus, is known for causing severe hemorrhagic fever in humans and non-human primates. It was first identified in 1967 after simultaneous outbreaks in Marburg and Frankfurt in Germany, and in Belgrade, Serbia. The virus is highly infectious and can spread rapidly, making it a significant threat to public health. It can cause deadly outbreaks. The mortality rate of Marburg virus disease can be as high as 88%, depending on the virus strain and the quality of medical care available. Outbreaks often result in widespread fear and disruption, as communities struggle to contain the virus and care for the infected. The impact on healthcare systems can be devastating, with hospitals quickly becoming overwhelmed. Rwanda, like other countries in Africa, is at risk. The country's dense population and frequent movement of people across borders increase the likelihood of an outbreak. Additionally, limited healthcare infrastructure in rural areas can make it challenging to detect and respond to cases promptly. The government and health organizations are working tirelessly to prepare for potential outbreaks and to educate the public about the risks. Understanding the virus is crucial for everyone in Rwanda. Knowledge about how the virus spreads, its symptoms, and preventive measures can empower individuals and communities to take action. Public health education campaigns are essential in disseminating this information, ensuring that people are aware of the steps they can take to protect themselves and their loved ones. This knowledge can help protect you and your community. By staying informed and vigilant, communities can reduce the risk of an outbreak and respond more effectively if cases do occur. Simple measures such as practicing good hygiene, avoiding contact with infected individuals, and seeking medical attention promptly can make a significant difference. This essay will provide important information about the Marburg virus. We will delve into the history of the virus, its transmission methods, and the symptoms to watch for. Understanding these aspects is the first step in combating the virus and preventing its spread. We will discuss its transmission, which occurs through direct contact with the blood, secretions, organs, or other bodily fluids of infected people. The virus can also spread through contact with surfaces and materials contaminated with these fluids. Knowing how the virus spreads is crucial for implementing effective prevention strategies. Symptoms which can include fever, chills, headache, muscle pain, and a rash. As the disease progresses, patients may experience severe symptoms such as jaundice, inflammation of the pancreas, severe weight loss, delirium, shock, liver failure, massive hemorrhaging, and multi-organ dysfunction. Early recognition of these symptoms can lead to timely medical intervention, which is critical for improving outcomes. We will also talk about treatment options, which primarily involve supportive care. This includes rehydration with oral or intravenous fluids, maintaining oxygen status, blood pressure, replacing lost blood and clotting factors, and treating any complicated infections. While there is no specific antiviral treatment approved for Marburg virus disease, experimental treatments and vaccines are being researched, and the importance of early detection. Early detection and isolation of cases are vital in preventing the spread of the virus. Rapid diagnostic tests and vigilant monitoring of symptoms can help identify cases quickly, allowing for prompt medical care and containment measures. Please read this information carefully. Staying informed about the Marburg virus and understanding the risks and preventive measures can save lives. It is essential to take this threat seriously and to be proactive in protecting yourself and your community. Share it with your family and friends. Spreading awareness is a collective responsibility. By educating others, you contribute to a safer and healthier community. Encourage open discussions about the virus and the importance of preventive measures. Together we can fight this dangerous disease. Community solidarity and cooperation are key in overcoming health challenges. By working together, we can reduce the impact of the Marburg virus and protect the well-being of everyone in Rwanda. The Marburg virus is a type of filovirus. It is related to the Ebola virus, another deadly disease. The virus was first identified in 1967. This happened after outbreaks in Germany and Yugoslavia. The outbreaks were linked to infected monkeys imported from Uganda. The natural reservoir of the Marburg virus is the African fruit bat. These bats carry the virus but don't get sick from it. The virus can spread from bats to other animals. These include monkeys, pigs, and humans. The Marburg virus spreads through direct contact with infected fluids. These fluids include blood, saliva, vomit, and feces. Humans can get infected through contact with infected animals. This can happen when hunting, butchering, or eating bushmeat. The virus can also spread from person to person. This happens through direct contact with the bodily fluids of an infected person. It can also spread through contact with contaminated surfaces or materials. These include needles, syringes, and medical equipment. The incubation period for Marburg virus disease is 2 to 21 days. This is the time between exposure to the virus and the onset of symptoms. The symptoms usually appear suddenly. They can be severe. Common symptoms include high fever, severe headache, muscle aches, joint pain, sore throat, nausea and vomiting, diarrhea, weakness and fatigue. Section 5. The course of the disease from mild to severe. Understanding the progression of Marburg virus disease is crucial for both medical professionals and the general public. This section delves into how the disease evolves from its initial stages to its most severe forms. Marburg virus disease can progress rapidly. In the early stages, symptoms are often mild and can be easily mistaken for other common illnesses. This makes early diagnosis challenging but extremely important. In the early stages, it can be difficult to distinguish from other diseases like malaria or typhoid fever. Patients may experience fever, chills, headache and muscle aches, which are common to many viral infections. As the disease progresses, more severe symptoms may appear. These can include severe abdominal pain, nausea, vomiting and diarrhea, which can lead to significant dehydration and further complications. These symptoms can include bleeding from the nose, gums and other orifices. Hemorrhagic symptoms are particularly alarming and signify a critical stage of the disease. Patients may also experience rashes, jaundice and severe weight loss. Organ failure, shock and unfortunately death can follow if the disease is not managed effectively. The rapid deterioration of the patient's condition requires immediate and intensive medical intervention. The fatality rate for Marburg virus disease is high. This makes it one of the most dangerous viral infections known to humanity. The severity of the disease and the speed at which it can claim lives make it a significant public health concern. It can range from 24% to 88% depending on the outbreak. Factors such as the quality of healthcare, the speed of diagnosis, and the timeliness of treatment can influence these rates. Understanding these statistics helps in preparing and responding to outbreaks more effectively. Section 6. Diagnosis and treatment, what you need to know. Understanding the diagnosis and treatment of Marburg virus disease is essential for managing this serious illness. Diagnosing Marburg virus disease can be challenging. The early symptoms, such as fever, headache, and muscle pain, are nonspecific and can easily be mistaken for other illnesses like malaria or typhoid fever. This is because the early symptoms are similar to other diseases. As the disease progresses, more severe symptoms such as jaundice, severe weight loss, and multi-organ dysfunction may appear, making it more identifiable. If you suspect you have been exposed to the virus, it is crucial to seek medical attention immediately. Early intervention can be critical in managing the disease and preventing its spread to others. Laboratory tests can confirm the diagnosis. These tests include polymerase chain reaction, PCR tests, antigen capture enzyme-linked immunosorbent assay, ELISA, and virus isolation by cell culture. These tests detect the virus in blood or other bodily fluids. Accurate and timely diagnosis is essential for effective patient management and for implementing appropriate infections control measures. There is no specific treatment for Marburg virus disease. Currently, there are no antiviral drugs approved specifically for Marburg virus, and treatment primarily focuses on supportive care. However, supportive care can improve the chances of survival. This includes maintaining hydration through intravenous fluids, balancing electrolytes, and providing oxygen therapy if needed. This includes maintaining hydration, managing symptoms, and treating secondary infections. Supportive care also involves monitoring vital signs, managing pain, and addressing any complications that may arise during the course of the illness. In addition to medical care, psychological support for patients and their families is important, as dealing with a severe illness like Marburg virus disease can be emotionally challenging. Ensuring a comprehensive approach to care can make a significant difference in patient outcomes. Section 7. Protecting yourself and your loved ones. Prevention is key. Preventing the spread of Marburg virus is crucial. There is no vaccine available yet. However, you can take steps to protect yourself and your loved ones. These steps include avoiding contact with bats and primates, wearing gloves and protective clothing when handling animals, cooking meat thoroughly before eating, washing hands frequently with soap and water, and avoiding close contact with sick people. Section 8. Public health response containing outbreaks in Rwanda. Rwanda has a strong public health system. This system is essential for detecting and responding to outbreaks. The government and health organizations work together to control the spread of the virus. Public health measures include surveillance and early detection of cases, isolation of infected individuals, contact tracing and monitoring, and safe burial practices. Section 9. The importance of awareness. Early detection saves lives. Public awareness is crucial in the fight against Marburg virus. Knowing the symptoms and transmission routes can help prevent the spread of the disease. Early detection and prompt medical attention are essential for improving survival rates. Educate yourself and your community about the virus. Share this information with your family, friends, and neighbors. Together we can create a safer and healthier Rwanda. Section 10. Marburg virus. A call to action for a healthier Rwanda. The Marburg virus is a serious threat, but by working together, we can protect ourselves and our communities. Remember these key takeaways. The virus spreads through contact with infected fluids. Symptoms include fever, headache, muscle pain, and bleeding. Early detection and supportive care are crucial. And prevention is key. Avoid contact with bats and primates. Practice good hygiene and follow public health guidelines. Let's stay informed, stay vigilant, and stay healthy.